All right. Hi, everyone. Thank you so much for taking the time to join us. My name is Brittany Blacker. I'm one of the account executives here at Weiner Benefits Group. We're really excited to have Chris here from the Department of Labor to be able to go over what is going to be happening with the Paid Leave Act. So anyone that's joining Zoom, we do ask if you can put yourself on mute. We do have time for questions towards the end. Please help yourself. Food, drinks throughout the presentation. There are bathrooms all the way down at the hallway over there. I don't know if there's bathrooms over there, so if you need to step away, please help yourself. So we wanted to be able to provide just a little bit of a background of who we are. Great. Who we are as Weiner Benefits Group. This is our mission and vision statement. This is who we are and what we stand behind, not only as a company, but as an employee of Weiner Benefits. We have been around since 1938. So we have been around for a very long time. We are in our third generation of clients. So they've been around longer than Lewis and Mike, who are partners with, I don't know where Mike went, but so long-standing relationships with our clients. This is who we are as a company. This is the entire team here, and most of us are here. Weiner team wants to say hi and raise their hand just in case you haven't met some of us. I know I started during COVID, so I actually haven't met a lot of people in person yet, so I believe we're all still there. But you have Lewis and Mike there, the two partners. Debbie, she is the Director of Medicare Services. And then you have the three account executives, myself, Denise, and Stephanie. You have Tom, he is the Investment Associate on the retirement team, along with Matt Moody, who's the Client Service Associate on the retirement team. You have account managers, James and Wendy. And then we have our client service manager, Adele. Lacey Gross, she's our account administrator. Jen is our account coordinator. Laura is our account analyst. And Allison is our client service associate on the employee benefits side. Here's a brief overview of what we do here at Weiner Benefits. So some we may work with you on the benefit side, some we may work with you on the retirement side, some we may work with you on both sides, but also we have voluntary benefits, life insurance, disability insurance, not only for group, but the individual side as well. Alternative healthcare funding solutions, strategic planning, personalized service is all that you will receive being a client here with Weiner. We have HR systems and solutions to help you, compliance support, retirement, which includes defined benefit and cash balance support, actuarial support. We have executive benefits and non-qualified plan solutions. So if there's anything here that maybe we haven't had a chance to discuss with you that you are interested, please let us know. We can set up a time. We'd be happy to help. I'm going to pass this over to Lewis so he can touch briefly on retirement.
Well, and you already mentioned it. Thanks, Brittany. But in this environment that we're in with all the challenges and turnover, we want to keep our mission critical people in their seats. And we provide a lot of services in non-qualified and qualified benefits to help keep those people incentivized in your company. So if you have those concerns or questions, talk to us about it. We can help you with that. There's all kinds of ways to help keep those people in their seats. And if you're not aware, we have a full retirement plan service provided, fiduciary compliance support, investment options, analysis, plan design, benchmarking, target date consulting, education and engagement. So if you're not already participating, we'd love to be able to talk to you about those things. And then, believe it or not, when you work with benefits and everything from hire through retirement, people actually do retire. Go figure, right? And so we started doing individual wealth management as well to keep those people on track towards their retirement. So that's the gamut of everything that we're doing here. And at this point, we want to introduce our speaker. You want to do that?
Sorry. This is Chris. He's from the Department of Labor. So this is your presentation. So I'll pass it off to you. Thanks, Chris.
All right, thanks. I'm Chris Granahan. I'm the Director of Delaware's latest division, the Division of Paid Leave. Definitely a little bit like me. I actually come from a background of group underwriting. I underwrote employee benefits for about a decade before I went back to academics after 9/11. One of the last things I did was work for Allianz as their U.S. North American operations manager to build an insurance company. And one of the things that I always wanted to, one thing that was always incomplete about my career is after 9/11, basically Allianz, I left Allianz never set up their business for expats here in the U.S. and this is my opportunity to build an insurance company. You usually ask, what other states do I kind of compare and model our program based on enough of these on? And my answer is like, no. I actually based it on private insurance because I understand how important it is to serve the employer. So much of the focus is on public insurance is always on the employees, and that is great. We need that. But if the employers don't see value, if they don't have an ease of use, then there's going to be an uprising against it, and this benefit will disappear. And I think that this is an extremely important benefit for your employees, and all of you are employees as well as employers. So this can actually help you in your life as well. What are we talking about? The sandwich generation. Tracks between that track. Well, extremely happy to be here. We don't wish a bill, not very often, but between our kids, their medical needs, the need to take care of them, and engaging parents, making sure that we have the ability to take care of them as well. If you look at this, that guy looks like he had it left out a long time. All of the responsibilities, all the efforts. One of the main problems in America right now is the savings rate, especially for not just retirement that you guys are talking about, but for emergency issues. Right now, people who are, have that 3 to 6 weeks or 6 weeks to 3 months savings account for, basically upcoming emergencies. Only about a third of American households have that. Before the pandemic, it was 2/3 of American households. If you look at different age cohorts, millennials, which aren't that young anymore, are 73% of them say they live paycheck to paycheck, no savings whatsoever. Why do I bring this up? Because what Pay Value, I believe, really is an insurance program wrapped around FMLA. FMLA has been around for a long time, 30 years, but it's been unpaid. But the idea was, 30 years ago, there were enough households that had those emergency savings that if something happened in your life that you needed to take time off for, you were able to take that time off if you had those emergency savings to dip into. Fewer and fewer American families, American households are able to say that anymore. Yep, one back. There you go. But the other thing is for you guys, the employers. This is the toughest, tightest labor market in decades. Not going away. This isn't a pandemic thing. This isn't an extra $900 in their unemployment insurance paycheck. That ended months ago. Those savings are expunged pretty much. People aren't falling back on that anymore. This is a demographic problem. Baby boomers finally started retiring after COVID. They had to stay in those positions longer. Now they've actually been exiting, and the younger generation just aren't large enough to take over what the sheer size that baby boom the population. So we need a competitive edge, Delaware employers do. Employee benefits are designed to attract and retain employees. You get out to keep out. That's why we don't have universal health care. That's why we actually do this through the employers. States nearby us have this plan or are getting it. New Jersey has had a plan just like this since the 1920s. They've been doing it for a long time. We have a lot of examples to learn off of from places like New Jersey, Rhode Island, California that have had this for decades. But Maryland, just about to get it. DC has had this for a while. And here in northern Delaware, I talked to Deladani when he was bringing us around that sort of the newly revisioned concept of what that campus was at Avenue North now. But it used to be AstraZeneca's headquarters. When AstraZeneca first moved their group over there, 80% of their employees in that new location were from, outside of Delaware. you reach into these other states to go and get those pools of talent. And if you're going up against New Jersey and you don't have paid family medical leave, that could be a problem. Same thing with Maryland. And if you're in competition with somebody who's from PA, you're actually now able to offer them something that those PA aren't. So this is something that can actually help. Oh, look at that.
Sorry. We're having some technical difficulties on the Zoom.
Anyway, I can keep on talking. I don't need this. So this is a way for us to basically even the playing field, because this is the most important part of attracting and retaining good employees. All right, so what is little history, talked about it a little bit. FMLA has been around since 93, 30 years. We are basing this program on FMLA to the extent that, even more so than the other states that are out there who do pay family medical leave. We're using FMLA as sort of a guide because it's well understood. If you're an employer that has 50 or more employees, you've been doing this for 30 years. The courts understand it. The benefit people understand it. They're here to help you go through the process of understanding it even a little bit better. Now that it's paid family medical leave instead of it's unpaid FMLA. So it's been around for about 30 years. It provides job protections, anti-discrimination. If you are on FMLA and you keep on paying your insurance premiums, you get to keep your medical health insurance. It provides some good stuff. But if you like to eat, if you like to keep your house, getting paid is an important thing. So for 30 years, this is a promise, and now it's something that is even less and less able to be actually fulfilled, that promise, that you can take this time off. 20 years ago, California started the first real paid family medical leave as a wraparound insurance program around the unpaid benefits of FMLA. And it was May 22 that the state of Delaware entered into this program. That's when the governor signed that. May 22 is important because for grandfathering, that's the day you were supposed to have had your comparable plan. So if you've created a plan after May 22, after this law went into effect, that's wonderful. We appreciate it. Your employees appreciate it, but it doesn't count for grandfathering. That's actually there's nothing I can do about that. So when I started here, just a little bit about a year and 2 months ago, there was only 11 paid family medical leave programs. Maine and Minnesota joined. Now we're at 14, and we say jurisdictions because DC, not state. So I tend to say state, but I mean jurisdictions. So the confusing part of paid family medical leave is that it's not one thing. It's 4 things. And the confusing thing about being 4 things that's bundled together in 3 different lives, because, things weren't difficult enough. So start with, it's the same types of stuff that's carried under FMLA. Parental leave. It's when you have a healthy kid. You get up to 12 weeks to take care of that healthy kid, not to take care of the bonds of that healthy kid. Medical leave is a lot like short-term disability. It's triggered by the same thing. Serious health conditions. Whenever we talk about health conditions here, we do mean serious. We mean either in the hospital or just out of the hospital. This is not for the sniffle. That's what sick leave is for. So medical leave is when the employee themselves is sick. That's exactly like, well, not exactly, but a lot like short-term disability. And the first 2, parental leave and medical leave, most of you probably provide this to your employees. But I can guarantee you provide it cheaper. And we'll cover those who might not get coverage in other places. When I used to be a group underwriter, and again, this is a while ago, we wouldn't even quote on groups with less than 100 employees. We go down to 10 as a mandate, down to 1 on a voluntary basis, 1 employee. So short-term disability, medical leave, parental leave, these are available to your employee, same price. If you are used to unemployment insurance, the more you use that plan, the more the rates go up. This is a We're grading the entire state, 400,000 employees. So much more stable and stability to the rates. And also the plan of benefits is the same, whether you take it on a voluntary basis, whether you're small, whether you're huge, same plan of benefits. Now, family caregiver leave is sort of the unique thing. This is the thing that doesn't happen very often. In fact, there's not a single insurance policy in the state of Delaware to help with family caregiver leave issues. That's when you're the employer and your child, your spouse, or your parent is ill or injured, seriously ill or injured. Allows you to take time off and take care of them when they're unable to take care of themselves. Qualified exigency is a weird term, but basically what it means, it's about the people who stay home when they have a loved one who goes overseas on military deployment. It has to be overseas, it has to be France or Singapore. It can't be California. I don't know why, but we follow FMLA. And FMLA has some good stuff, that idea of the regulations being tried and tested. There's stuff all over the internet to help you understand how to understand and implement FMLA, but it also has some weird stuff, starting with that name, qualified exigency. It comes from FMLA, but also some weird stuff about that overseas military deployment. Hawaii and Alaska count as overseas military deployments, but not California. See, like they're pretty far away, all of them, but what are you going to do? But the other thing is, you notice what's included and what's not in terms of which type of patients we cover. Child, that makes sense. Spouse, that makes sense. Parents, what's missing from there? Sibling. What if you have a brother or a sister, your parents aren't around, you're the only one around who can help them in a serious times of crisis? FMLA has never, for the last 30 years, been able to help you with that. And unfortunately, since we follow FMLA, that's a restriction on this plan. Also, parent. If you read that carefully, not parent-in-law. I know we joke about our mother-in-laws, but it would be nice if we could take care of them as well. But we follow FMLA for the good or the bad. There's also 3 ways to take that leave. Consecutive leave, that's what we usually think of. That's just I'm taking off here and then coming back then. Second one is reduced schedule leave, when the doctor says they can't do full-time work, but they can do every other day part-time. And they'll do that for the next 4 weeks. A regularized, shorter program of work scheduling. And then the last one is intermittent leave. That's the one that's always been the difficulty for employers trying to manage their FMLA programs. In FMLA, you get as low as a single hour of FMLA job-protected leave, so that you can go take your kids to the doctor, come back. Unfortunately, because we have a paid aspect, we have to go through the process of preventing fraud and sending money, all the administrative effort around that. We only do a day or more of that leave. So your employees, if you're more than 50, your employees can still take that hour leave. They just don't get a paycheck for it. Well, not a paycheck. They don't get a claim check from it. And so that's it. What actually do they get? For new kids, for parental leave, it's up to 12 weeks every year. For the other 3, it's 6 weeks every 2 years. So that's really kind of about 3 weeks per year, but really 6 weeks in a block. This is all, you can get 12 weeks, you can get 6 weeks, you can get 6 weeks, you can get 6 weeks. These are all separate. If you have a family member who's sick and a kid who's healthy, you get to split the time between the 2 of them. The limit is no more, no matter what the type of leave, no more than 12 weeks in any 12 months. That sounds complicated. We've got all these different time periods, all these different lengths of time. When you toss in intermittent leave, this can get really, really complicated. But we are working, we just can't go into the details, but we just signed a deal to exclusively negotiate a contract with an online system developer. And we have one of the best companies in the world, a $70 billion corporation who wants to get into this area. Is going to throw all the resources we need because they want to stay in this area and work in paid family medical leave and other government work. They built very complicated, literally rocket science kind of programs before. So we really don't expect it to be too difficult for them to handle. And it will have a calendaring and tracking system. So if you have intermittent leave, that means you get 6 weeks every 2 years. That means every day, that means 30 days. I don't know if you didn't have our calendaring system, I guess you'd take out a sticky note with a person's name across the top and start tracking the number of days. Our computer system is actually going to manage that process for you. So it's an income replacement. It means two things. First of all, replacement means they have to be at work. They're not at work, they don't get this. So this is actively at work system. They can't have been fired. One of my nightmare situations of this is because the employers are the ones who are doing the initial round of claims adjudication. My personal nightmare is that an employer someplace is going to decide that this is a great severance package. Well, I'll just give you 6 weeks of paid leave. I'll sign off on it. We have a friendly doctor. They'll sign off on it. That's where we're going to be doing a lot of auditing work, a lot of review work behind the scenes to make sure that we catch that kind of fraud as soon as possible. Income is FICA. There are so many different components of wages. Earnings, which starts on 1/1/25, has a slightly different definition of wages than we do. Unemployment insurance has a different definition of wages than we do. We simply follow FICA. Whatever the FICA is on the paycheck is whatever it is for paid family medical leave. And that's both for the contributions and it's for the benefits. So it's income, FICA income, it's 80% benefit. If they get approved for their claim, it is an 80% of their average wages over the last 12 months. And it's a maximum of $900 a week. What that basically means is if your employee makes $52,000 or more, they get $900. If they make less than $52,000, they get 80% of that's where they hit that $900 a week cap. Eventually, it's going to be indexed to inflation. That happened in like 2008. By that time, $900 is when it worked out $7.50. It's less than 1% of an employee's salary is the funding mechanism. So this is insurance. You pay a smaller amount while the plan is in force on a monthly, regularized, scheduled, predictable method. And then when they go out on a claim, which happens on a unscheduled, unpredictable manner, they get paid through us. You no longer have to pay them. You cut their paycheck, we pay them. We pick up your slack. And it's 0.8%, 0.8% of wages, of that FICA wages. FICA also has a maximum, $160,200 per year. So if you have high earners, if there's any attorneys, any top level executives, after they hit that $160,200, which is the same place that they stop paying Social Security taxes, that's when they stop paying into the contributions for paid family medical leave. Employers are responsible for 100% of the program. If there's a error, it's probably been done in the accounting process. So you guys can split up to 50-50. So you can, if you want, take 100% of it. You will take 80% of it. You take 50% of it, but you can't take 30% and have the employee pay 70%. It has to be 50-50 or better. Which means you guys are doing payroll deductions. Which means just like every other payroll deduction, you hit that paycheck for the earned. If there's something earned in that pay period that you did not deduct in the paycheck, 100% responsible for the employer. You can't go back or you can't go forward to future paychecks and get what was owed in the past time period. Because of this, I am shocked. Considering, for a decade I've worked with employers. I'm shocked by the number of employers where I feel like, you know what, it's just not worth
doing this split. It might just be administratively easier to do both. And if you're in a situation where you're up against another Delaware employer, and that Delaware employer pays 100% of paid time on the leave, and you're paying 6%, it could be a consideration. I don't know. Some people would worry about this. Cost for every $50,000 of salary, this is $1,200 a year. If it's 50-50, that's $200 a year. Divided by 26 paychecks, that's $7.70 per year. So that is what is sort of the concept. I mean, it's $770 worth the headache of explaining to the employees. That's up to you guys, your employers, your employees. And so basically, he's got everything. First of all, you have to work primarily in the state of Delaware. Primarily was never defined. So I just was looking at it saying, well, primarily sounds like more like most, more than 50%. So it's 60%. So if any quarter you have employees who work 60% or more of their time in the state, physically in the state of Delaware, what are we talking about here, telecommuters? We're also talking about contractors. If you work at contracting firms, sometimes they're here in Delaware, sometimes they're across the line in PA or New Jersey. You're already tracking that for state tax purposes. This kind of applies the same thing. How it's if you spend 60% of your time here physically in the state of Delaware performing work. You have to have worked, if you're an employee, for 12 months with that employer. If you switch to another employer before you hit 12 months, you have to start all over again at day one of that 12-month period. If you've worked for 20 years for the same employer and you satisfied with a long time ago, you go to a different employer, you start with day one at the new employer for this. A lot of the legislators are thinking that that's harsh, so that may change that yet, but we're working on a computer system that can handle that. Because what do you key the system to? Key it to the employer or the employee? You have to kind of make these decisions now when building a database, when building a computer system, because once we have 400,000 employees, 10,000 employers enrolled in this program, and then we start changing stuff like that, it's like changing the oil in the car on I-95 while you're driving 80 miles an hour. So we prefer to get this and future-proof this and plan for all these different variables. But 12 months comes out of FMLA. The next number also, 1250 is a weird number, comes out of FMLA. Every year, even after that first year, you do a look-back period. Has that employee worked at least 1,250 hours in the previous 12 months? And that comes out to be round about 25 hours a week. If you are in retail, if you are in the restaurant, that's problematic. They cost 3 8-hour shifts, 22. But it's right on the edge there. I guess this is the MLA. We want to try to keep it consistent as much as possible. The system will track this stuff. However, what that means, though, is we need hour and wage information from you guys or your payroll providers or your HR consultants, however you set it up. We need hour and wage by employee, by week, every quarter. So this is much more information intensive than other government programs. But the hope is that we actually set it up so that your computers talk to our computers. There is the National Payroll Reporting Consortium, the NPRC, Paylocity, ADP, all of the largest, but the most of the mid-sized and even a lot of the small payroll provider companies are part of the NPRC. The NPRC designs and implements their database. The idea is that you as the employer can switch between those NPRC companies pretty easily. We're going to be working with the NPRC. And for instance, one of those companies, Paylocity, has 3,000 accounts in Delaware. So we work with one guy and we have 3,000 working streams of information that, our computers are talking to their computers, it's all going to be fine. But if you're a small company and you use QuickBooks or some other thing, all of them have export to Excel. We will give you the format for what we want that Excel spreadsheet to look like. Information, no information only. There's no actual formula, so we're looking for information. So we'll tell you what it should look like. You'll set up that report every quarter. You'll just press the button. It'll set up that report. You'll email it to us. It should be as no problem. It's going to work out great. And the online system will take care of everything for you. Yeah.
But if you do employees that aren't going to fall under this, and they still get charged the payroll tax.
Thank you very much for that. Yeah. Let me get right to that. Let me just finish this first. This is quick. Who complies? If you have less than 9 employees, or 9 or less employees, it's voluntary. You can opt in. If you have 10 to 24 employees, all you need to do is provide them that bonding coverage, that parental leave. You can give more if you wish. Why would you do so? To attract and retain employees to get this coverage at a cheaper, better rate than you would on the marketplace. 25 or more employees, you have to take all of this. Insurance covered, everybody's covered. There's only a few exceptions to the rule. One of the exceptions is the federal government. States can't tell the federal government what to do. It works the other way around. They tell us what to do. That goes with railroad workers. So Amtrak, we can't tell Amtrak what to do. Federal Railroad Workers Act covers their employee benefits. Seasonal operating businesses, which is kind of what you're talking about, but not totally, but we'll get there in a second. It's your fund land. This is told to me to be the fund land exception. If you are fund land and you close down and do not do commerce in the state of Delaware for at least 30 consecutive days, then you're exempt. None of your employees are in this program. You never have to contribute, and they never get the ability to put in a claim. So if you close down for 30 days in a row, Funland called us with so we've done are about to send our second round of regulations to get them to public comment and then into effect. But the first round, we kind of figured we thought we had this, and then Funland called us and said, actually, we do have people who work, year round. We have people maintaining the building, people maintaining the rides. We have people doing HR stuff, people doing accounting stuff. We have people who get paychecks who show up for work every single day. And we're like, it's a Funland exception, doesn't cover Funland. I got to rethink these regulations. So then round 2 is rethinking the regulations in this area, changing it from closing the doors and turning off the lights to not doing commerce. So if you don't have paying customers, yeah.
What is less than 10? Which benefit anyone?
Well, there's a process. So these are threshold numbers. 25 is a threshold number, and 10 is a threshold number. Things happen when you go above or below 10. Things happen when you go above or below 25. The rule of thumb is that benefits are easy to gain, hard to lose. It's actually written into the act. So once you go above 10, once you go above 25, all of your employees automatically get the new benefits. They get to keep them for at least 12 months. So it's not if you go up 1 month and then down 1 month, they come and they go. Because first of all, there's a requirement for 30 days notice. You have to give your employees 30 days notice so they get a little heads up and they can plan their lives. To do that back and forth is insane. So on the 13th month, that's when it's been gone below and they've been below. Once they've been below for a full 12 months, and the 13th month is the first time that they can be below for the 12-month period, then they can lose the benefit. So again, easy to gain, hard to lose. And there's a process for that. And of course, the online administrative system is going to handle that for you. So this is the other part of this. Waivers is the other part of this. So how do you count towards the 10 and towards the 25? It starts out pretty simply. Start with everybody. Part-time, full-time, seasonal, casual, everybody you've got starts with the number. Then you subtract out, those on waivers. Waivers are if you and your employer, if you as the employer and the employee mutually agree that this job position was designed for somebody, is intended to only be for a short amount of time. It's only designed to be 2 shifts a week. Now, my daughter started at Grotto's, and she was the hostess. So she went up there and she worked, she said, I just want to work in the summer, and I just want to work 3 shifts, which 3 5-hour shifts for a hostess, 15 hours. She was never going to hit the requirements for this plan. If she and the employer both signed a waiver, and this is something that you guys are going to have to start including in your employment packages. But if they both sign it, then that 0.8% of her payroll would never be put in for the contribution, and she would never be able to take claim. If Grotto said, you know what, you are the best hostess we ever had, and she was horrible, that's not going to happen, but we would like you to work for us forever, she would have quit Padua, she would not have gone on for UI, UX design, the front-end computers, saved us a lot of room, we could have gotten a new hot tub. Anyway, but she would have worked at Grotto's, they would have revoked the waiver. And at that moment, that's when she starts getting the contribution paid, either for her or half and half, and then that's when she starts being eligible to do the claim. And the time that she worked prior to while she was on waivers counts towards the 12 weeks. So you get the benefit of even part-time work. That 12 months doesn't say full-time, part-time, or anything like that. So that's the starting point. You start with everybody, you subtract out those part-timers, those short-timers. If you're in the restaurant biz, that's a line. Stats. As you get closer towards hitting the 12 months, as you get closer to that 1250, we're going to still need the information about those employees, because we're going to track them and let you know these guys are just about to hit their maximums. You have to take them off the list. Because if you take them off the list, you won't get penalties. If we force you to, then there's only some penalties involved. Adding in reclassified employees. What if you have, here in this office, you have somebody that you hire out of Chad where you were hired during COVID. What if you were hired and you stay in your Chad Ford kitchen doing your work, but you beam in for every single meeting with your Wilmington team? You feel like part of the Delaware team. And if you and the employer is, since you work, 100% of the time in Chad Ford, you don't hit that 60%, that primarily in the state of Delaware, so you're not eligible to be in this plan. But if you and your employer both agree, you can be reclassified to be treated as a Delaware employee and be included in this plan for as long as you want. If PA doesn't have a program, if it's somebody in Maryland, you could switch that up and you could say, all right, actually, Maryland now has their plan in force. Instead of paying in both places, I'll cancel my Delaware and I'll do my Maryland only. Then you can declassify. Then that person gets excluded. So, starting point, everybody in, subtract out those on waivers, add in those reclassified. You probably won't have any reclassifications. So it's really just subtracting out the waivers. That's how you get to the numbers. So this is what we're doing right now. This is grandfathering. As I said, there's 14 states total, 13 besides us. The other 13 don't have this grandfathering option. What they did is on the date that the program starts, all of your existing programs, whether it's an in-house thing you did out of pocket or an insurance policy you paid Allstate for, all of those goes away. And then you just start fresh, you start clean. It's actually clean on easier. However, for those companies that have been providing this benefit for years, some of them your benefits than what state was providing, some of them pretty darn close. The legislature basically wanted to say, thank you for doing that. You can kind of extend your existing plan for the first 5 years of the program. So there's an application program that's going on right now. You come to our website, we'll have the contact information, and the website will be on there at the end. It's also on these little handouts we handed out, the de.gov/paid leave. If it's front slash or a backslash or whatever. It has a big green button that says go to the grandfathering portal. And it's a really simple process. I've been told it takes no more than 10 minutes to complete. And it is, so there's a portion there that's not 10 minutes long, and that's the identity proofing. if you ever looked at UI, if you ever tried to do stuff electronically with the federal government IRS, you've gone through this process. Your driver's license, take a picture of the back, that real ID scan thing. The camera takes a picture of you. It does that. It does a biometric. It's like you're in Terminator or something like that. Hopefully it isn't really like Terminator, but it's like that. And it proves that you are you. That can either be a very simple process or a much more complicated process, but it's a state requirement and I can't really do anything about it. So you have to come through that. But once you get through there, it would be basic information about your company, who the contact people are, and then what kind of coverage you already have that you would like to grab. The setup is like a TurboTax. Every question you ask, let's use your own adventure, brings you to the next question. Eventually those questions stop, 10 minutes long, at most is what we've been hearing. Then you either get conditionally approved or conditionally declined. Conditionally declined because you don't meet what we call comparable. Comparable is in the act, doesn't define what comparable was, so we just decided 10%. If you're within 10% of the requirements of the act, so 80%, so 80% is the requirement in terms of benefit percent. If you're within 10% of that, technically it's 72%. That's due 8, like that's 80, 72. And then if nobody has a plan that offers 72% coverage, in actuality, 75%. For instance, if you have short-term disability plan that has 75% coverage or better, you may be eligible for this. Same thing for the benefit weekly maximum and the weekly duration, within 10% of what the state says. So these are specific numbers. You just need to figure out what those numbers are. We just added a couple weeks ago instructional video and a list of every single question you're going to essentially be asked in this program. So if you want to, you can gather the data before you ever open the screen. But if you open it, you get declined or you get approved, you can redo it if you want. If you made a mistake, you made an error. The last thing you need to do in that application process is upload a copy of your existing written policy. It's one of the things. It's got to be written. If it's whispered down the lane, that means sometimes, the boss's daughter gets it, but not the judge. We have to make sure it's evenly defined and usually in writing is the way to do that. And it had to have been there on the day it was signed into law. So it had to be the policy as of May 10 of 22. So those are kind of the minor things. That's open right now. You can go and use it right now. We have people manning the cover of the phones, 24/7, 365. Christmas, you can call, and there will be somebody answering. Probably won't be our best people, but there will be somebody there. And the state workers, we don't do 365. So this is a thing that we hired out, a call center based in South Carolina. If they have if you give them a question that's too complicated for the training we provided them, they'll send it over to us. We'll do the research, get back to you by the next business day. So Friday night at 1 o'clock in the morning, you go and call after your restaurant shift is done. You call us with a question. We'll give you the answer Monday morning to help you through that. That is only open. Oh, the other thing is TLD. If you are an employer with between just 10 and 24 employees, anybody have that here? All right. Instead of 12 weeks, you can tell us that you will be reducing that leave down to as little as 6 weeks. So you go to half, because we know, or the legislator knew, that's a big burden. One person being out for 12 weeks is a lot of time. The one thing that we have learned in all the states, the 13 states that have done this, some of them in California for 20 years, one thing that we have learned is that although they are eligible for 12 weeks, they don't take 12 weeks. Most of them take between 6 and 8 weeks of paid parental leave. Why? Because their spouse, their kid, their parents might get sick. Because they might get sick. And they want to save a little money, a little time in their back pocket because they have that 12-week maximum per year for any cause. So that's sort of a process. This is only open until December 31st. At midnight, Just like Cinderella, this turns back into a pumpkin. And grandfathering ceases to be an option. And what that means is, if you have an existing program, you didn't grandfather it, then when this program begins, you either have to join the public plan, get a private plan, we'll get into that in a second, or be not be compliant. So, those are the, and grandfathering only lasts 5 years. So on December 31st of 2029, you're going to have to go into the process of either joining the public plan or getting a private plan, private insurance or self-insurance.
I think they question the risk of grandfathering. Yes. Because if it wants to opt in, like probably 10, 24, do they have to do that now?
No, because opting in is a different process. Yeah, grandfathering is only for companies that have a mandate that they're required to provide this coverage. So there is a weird area in between, but all right. So September of next year, we're going to have another portal that's going to open up for just 3 months. And during that 3 months, either you opt in, or to mention what that is, if you're a smaller employer, and you have to provide some or all of the coverages, you can opt in. Same rates, same benefits, same terms, same conditions. And you have until December 1st of next year to do that. Opting out is if you're a larger employer and you choose not to join the state plan, then you can buy either private insurance, and that private insurance is right now getting certified. There are different insurance companies from around the country. Again, this is offered in 13 different states. So that means there's insurance companies providing this coverage in other states. California, big marketplace. There's a lot of companies providing Cape Town in the middle of the in California. The question is, do any of them want to come here and provide coverage to what is a smaller marketplace with a different set of rules? But they're going to go through the process. Department of Insurance is going to take them, and if they're approved and you purchase one of them, send us the cover letter. You're like, it's more of a process of notify. You're in that plan. The other way to opt out is to set up a self-insured plan. And self-insured plans are complicated. You need to have some sort of you have to have some administrative capacity. You have to know how you're doing when it's like, there's going to be ASO companies, administrative services only companies that are going to provide support. I'm not being area where you guys want to expand into ASO coverage for self-insured to provide that help. But you have to have a set of bank accounts. You have to have money set aside in your reserve, pre-funded, just sitting there. Whereas, insured, you just pay the premium. And you have to have a surety bond that you have to get a new surety bond every 12 months based upon the changing demographics and risk assessment of that group. So self-insurance is there, and opting out through private insurance is there. Again, that's for the next phase of this process. After that, on 1/1/25 is when premium starts. Now, if you read the Act the way I did when I first looked at the Act, when I was, deciding whether or not to interview for this job, it says, that's how you read it. It looks like it says that employers need to send us their money upfront. In other words, since this is based upon a percent of salary, you guys had to guess how many employees you're going to have, what their wages will be for the next quarter. And I'm like, oh no. Because at the end of the quarter, the actual numbers will come in, and then we'll have to do a true up. Credit, debit, move forward to the next calendar quarter for billing. It would be a complete mess. So the one thing that first thing that I did is I got that switched to be a retroactive thing. So you pay your premium 30 days after the end of the quarter. Just like you all. We follow the UI cycle for payment and for information. So 30 days after, so 1/1/20
I'm going to see.
Contributions.
I didn't see any.
Yes, please. Yes, please.
Yeah, 85 a ton. Like.
Right up, yeah.
Well, hopefully,
Excuse me, if you put it on mute, that would be great. Do this all over again. Oh, that reminds me. Over in the back, there's some freebies, those little cloud-looking things. They're meant to hold your phone. Portrait or landscape mode. And it's in phone, so if your employees aren't listening to them, it's also okay. You can shout right at it. Get a lot of frustrations out. I'm also been told that I'm not allowed to say. So anyway, but they're free. And normally, when somebody from the government says, "Oh, it's free," you're all like, "I paid my taxes for that," and I'm totally with you. No, these are actually free. They made a printing out, and they sent it to us late. So I got 500 of those things for free. So please take them. If you think anyway, so okay, so it's 1125 is the start of contribution. 430 is the actual first due date, and there's a 6-day grace period after that, and that's for money and information. If you have a payroll company, we'll work with the NPRC to automate this entire process. They believe through the NPRC, they believe they have between 60 and 70% of the employers in the state. So if we work with them, we're going to get 60 to 70% of the stuff working really well. We're actually having monthly meetings with them while we're in development, and we're going to go to quarterly thereafter because there's always going to be changes and updates to the law or to the process, just to make sure that this thing flows properly once it's begun. You can't just set it and forget it. What that means for you guys is if you're going to do the 50-50 split, you have to start withdrawing from their paycheck after 1/1 of 25. So every 2 weeks, you're going to be taking money out of their paychecks. You're going to be putting it aside. And that money is going to build up until you have half of the quarterly amounts. You want to add it to your half and then send it to us. You guys, if you want, could put that into an interest-bearing account, keep the flip. So smaller companies that be much larger companies that could actually be a significant savings and help you with the administrative costs of this program. The next thing is claims applications. That begins 1/1/26. So that's the weird thing about this program is that employees are paying into it, employers are paying into it for 12 months before claims collect. Why? Either we could have gotten a loan or a huge amount of money from the General Assembly so that we start off from day one with a full claims reserve to pay the expected claim, or we build it up from the people who are using it. So that's what's done. Not everybody is in this plan. Those who have less than 10 employees, which is a huge number. Half of the government, of the state's workforce is not in this program unless they opt in. So those people shouldn't be burdened with the costs if it went through the general reserve, general funds of paying for the whole thing. So the way claims are, yes.
Attention. The working in the next 5.5. Not to give the benefit.
Thank you.
A word of message.
It's insurance. What?
Okay, it's insurance.
Yeah, it's insurance. When the premium's paid in, it's gone.
It's going to that. But
yes.
Short-term disability rolling through 2025.
So short-term disability. So part of the second round of regulations, the most important part of the second round of regulations is what to do with coordination of benefits. You guys are, if you're HR professionals, have to hear that term in your nightmares, coordination of benefits. We have a pretty simple process for coordinating. Like to think so. So the coordination of benefits is work-related. In other words, work-leave comp, just like they would under a medical plan. So we don't cover work-related unless of interest. If there is a short-term disability, well, let's start with paid time off. Your sick leave, your vacation time. The Act says, and this follows FMLA, so it sounds weird. This is what happens with FMLA. Employers may require their employees to take FMLA, paid time off, but they may not allow them to use all of their paid time off. And they also don't, define what any of that means. So, if you are an employer, you have to make a decision before this program begins. for all my employees, do they have to take their paid time off? Because that paid time off, that sick time, that vacation time, is included towards that 6 weeks, towards the 12 weeks of benefit duration. So what happens really is, are they getting or are they not getting additional time off after the 6 weeks is over? If we paid the full 6 weeks from our program, if they weren't required, and it's up to you guys, not required to use their sick time or the vacation time, that means they still have all of their sick time vacation time to use after they come back. Which they may or may want to do, which you may or may not want to do. It's up to you guys. But it makes it complex. So one of the things about this program that is either brilliant or infuriating, depending on who you ask, is that the state is requiring the employers to do most of, if not all of the initial decision making. So when it comes to eligibility, when it comes to enrollment, when it comes to calculating the premium, when it comes to deciding whether or not somebody is eligible, whether a particular claim is eligible for payment, that's up to the employer. We're going to give you the tools and the advice about what to do, but the actual decision is up to you guys. So what's going to happen is on 1/1/26, the employees are going to go to a website, our website that we're currently building. They're going to fill out a form for a claim form. They're not allowed to hit send until all that information is in. By the way, no paper. This is all electronic. No lousy handwriting, no partially filled out forms, no my dog ate it. Whatever the case is, no forms lying around your office, which if you're dealing with any kind of medical information, you don't want forms lying around your office. So this is all on our secure website that's going to be HIPAA approved and pass all muster with all federal government requirements of secrecy and taking care of information, confidentiality. So they're going to submit this form. It's going to include all sorts of information about themselves, their job duties. You guys are going to have a chance to review the job duties, make sure that they're okay, that they have to do what they say they have to do, because that's what the doctor's going to look at. And then they have to provide the information how to get in touch with their primary health care provider, because the patient may not be them. It may be their parent. And it may be somebody in another part of Delaware. You guys have no idea how to get in touch with that employer or with that healthcare provider. That healthcare provider could be in another state. My wife, her best friend just had to use FMLA for her parents, and her parents were in Italy. So she had to get an Italian doctor to fill out the FMLA paperwork. We're going to send them an email telling them to come onto our website to fill out the form, and they're going to fill out the form. It's the certification of serious health condition. That's basically this person has a major illness. They're going to look at the job description, and if it's the employee themselves, they're going to say this person cannot perform these job duties. This is how long they came, so that's the leave duration. You get 6 weeks, but you only get approved for how long the healthcare provider says you get approved for, all medical necessity. And then it's going to say whether or not this person should be allowed to get the leave. And this is FMLA stuff. They've been filling out these forms for the last 30 years. Doctors know how to interpret this stuff, and they have plenty of help to interpret this stuff and to fill out this stuff. We're just going to give them the computer system to do it. But part of the claims application is going to be, how do we get in contact with the doctor? We need their email. We need their some way to get in touch with them. You guys and us at the division, this is all online. Some people aren't, good with the internet of stuff, the interweb. So we have the duty to provide reasonable assistance. It doesn't mean that you do the research for the information. They're responsible for getting the information. All you do is type it in. All we do, if they call us, is type it in. We're not doing research. You look up how to get in touch with Dr. So-and-so? No. No, we will not. We don't do that. So the information has to be complete before they hit send. No blanks. Filled out the way we're looking for it. And then when it hits send,
The doctor gets a copy of the note. You get a copy of the claims application. You can start working on the claims application, decide whether or not that job duty is sufficient, or is what they actually do, or what they is not what they actually do. You can update that. You can also say, all right, I get the information once a quarter into the computer system. You guys have the information every single day. So if a claim comes in, I'll know whether or not they were employed by you 3 months ago. You'll know if they were employed at the time the application was made. So you guys have fresher, more complete information. That's why it's good to have you guys doing this work instead of us, or in addition to us, because ultimately you guys are going to get a note that says from our computer system, based on the information you have in the computer system, you guys will give the additional weeks of information so that it's a full record, just like you do with UI. For UI asks for 2 years of information. We're just going to ask for the last 3 months worth of information, which should be handier to you guys. So you'll take that. We'll say, listen, based upon the information you have in the system, we would pay this claim. In which case you pay the claim. And we would not pay this claim. In which case you don't pay the claim. Unless you know something different. If you know, because you work with them or on the ground, you may even know that that person is not their grandparent, it's not their parent, it's their grandparent. This person is actually their uncle. This person is the mother-in-law. You guys have that information, but again, you might not. It's Delaware. You probably know, but we definitely don't. So it's going to be almost impossible for us to make those things. You guys are going to have a better idea, and that's going to help us run prevention and overutilization, which is the thing that's going to drive claims higher and higher, too high for sustainability. Anyway, so the idea is you guys will make the initial decision, but you won't make the only decision, because if you decline it, the employee can ask for a claims review, which means it comes to the division, and we look over what you guys did. We ask for any additional information. So if they don't like what you guys decide, to say, listen, here's the form, go fill it out. You're probably going to, you talk to the division. And if the division still declines it, they can go to an appeals board, which is an independent body appointed by the governor. If they still don't like it, they can go to the courts. And the courts are the ones where, for the first time, they can look at our regulations and tell us we did something illegal. We didn't live up to the act. And they can get something different. But up till then, we're all following the regulations. So, grandfathering portal is open, ready for business. Question is, do you want to do it? All of these things, whether it is, grandfathering, or whether you go into this for the opt-out, you can split up your lines of coverage so that you use, if you want, you can self-insure the parental leave. You can get an insurance policy for the short-term disability, medical leave portion of it, and then you can come to us for just the family care leave. You can do what we call hybrid plans. You can do that. You can do that with grandfathering as well. I have a short-term disability. I don't have the other thing, but I want to continue my short-term disability as is. They can do that. Question is, do you want to do that? Because now, well, I'm going to require the same amount of information. Hours, wages, each employee, every week for each quarter. So we require that same information if you take one line of coverage or all 3 lines of coverage. Family caregiver or qualified exigency go together. They travel together in pairs. What I find. There's 4 types of coverage, 3 lines of coverage, because those 2 follow each other. So, already dealing with one plan, why deal with 2? You guys might want to, because that's your internal thing. Your bosses want you guys to. You have your own system for risk management, whatever it is. You're free to do whatever you want. I'm just saying, think about this. September 1, if that closes on December 31st. September 1st is the opt-out, opt-in portal for next year. January 1 claims, first due date 4/30. This presentation is going to go to all your people, so this is all coming to you. You don't have to write this down or take photos of it. It's all going to be coming up soon. I don't want to get into this, but we're going to have tons of self-lead support. We're going to outsource as much of this stuff as humanly possible. And we're going to get experts who know how to do education and training, who will help us create informational videos and written documents, not some state worker
but professional who does this for a living, to go and help you kind of explain this. And you, of course, have your benefit consultants to help you out as well. Because if you have less than 50, if you have more than 50 employees, you're like, this is FMLA. Why did I spend all this time? But if you have less than 50, you're like, oh my God, what's coming? And we all kind of understand that. And that's really what we're kind of gearing up for, is that helping the smaller employer is really our kind of focus in this program. Online portal, yada, yada, training and education, yada, yada. Most importantly, that's my direct email. That's my direct phone number. Give me a call, email me anytime you want. I've spent a lot of time on a lot of cases. bit.gov is our website, FAQs, instructional videos, podcasts. If you thought this was fun, there's an hour-and-a-half version of it online. You could watch whenever you want, so if you can't fall asleep, I would suggest you get that. Play it in the background. It's almost as good as the whale noise. And then there's also about 5 different Q&As. One of them was 2 hours long. So you can find out all the information. But all those things that came up in QAs were added to the FAQs, frequently asked questions, so they're available in writing. This is a generic mailbox that gets reviewed and looked at every single day. And that's our generic phone number, 8375. So it's HGPO, the business paid loop. So you can call us anytime you want. Right through December 31st, we're going to have that 24/7, 365 coverage. Because that's for the grandfathering. After that, it's just going to be my staff. There's only 4 of us right now. We'll take your call, so it's during normal business hours. But this will go out to you, and anytime you want, give me a call. One last thing I wanted to mention is grandfathering. We've actually had 70 companies apply so far. We've only really declined about 5. 3 of those that we declined, we looked at their policy, and we said, actually, you have to be covered. We called them up, and we said, redo this, answer this question this way, because that's what's in your policy. And they got approved. There was 2 companies that said, oh, we do everything you're asking. And then we looked at their policy, and it was unpaid. And we're like, oh, you're not. So my generic statement is just like Ronald Reagan always said, trust but verify. You guys are going to give the information. Our job is not to, you're doing the implementation. We're going to be doing your review and auditing work to verify that everything's fine. That's how we make this as successful, as easy to use program as possible. That's it. See, that was easy.
Thanks, Chris. We'll go this way. How quickly are claims can be paid?
Yep. I think the act says once all the information is there. So if all we can do is check that the system has all the fields filled out, but if the employee types in a quick brown fox jumps over a lazy dog for one of those fields, you guys can say no, give me the information. Once all the information is there, once the note from the doctor is there, that certification of serious health condition, the act says, I forget, it's either 3 to 5 days, 3 to 5 working days. But at that point, you have everything. And all you need to do is either approve or decline it.
I could pick the meaty button.
I'm sorry about that. How long do you have to adjudicate, to make the decision about your plan? The clock doesn't start until all the information is in. And then it's either 3 or 5 days. The act actually requires that.
And I have 2. So
I'm sorry, Bongo.
we have 5 employees and they work out of their home in another state. Do we have to calculate the number of hours they're actually working in the office in our state?
Well, you're already doing that to state taxes, right?
Here, nothing like
So yeah, you have to do that to state taxes too. So, I mean, you're all already doing that allegedly. Although I talked to the Division of Revenue, they don't actually check, because it's also just like our program, self-reported. The only time they audit is if you are a diluted company, like a bunch of attorneys and we're talking about tens of thousands of hundreds of thousands of dollars that may or may not be in or out of state. That's the only I actually think. But our program, there are no federal rules about paid family medical leave. This is something where if you call up the U.S. Department of Labor, they will say, I'm sorry, we don't know what you're talking about. If you call up the IRS, they will say, I don't know. We don't know what to say. We don't know anything about paid family medical leave, which means how you guys do the tax treatment for paid family medical leave. 13 other states say, ask your tax professional. So this is one of the problems, is that it's treated differently state to state. And since we only have state authority, we can't take somebody's income earned in PA and tax it. And we can't pay a benefit upon their income paid in PA. It's just, if I was a PA judge, I'd be like, no. You can't do that. Delaware does Delaware. So I'm just kind of we only do in state income and state hours.
So like, second question is, if you have a short-term and long-term disability plan already in place, and does that disability company have authority to say they have to go through?
So, I actually started saying this and I got stuck on paid time off and I didn't get short-term disability. So the regulations that are coming out also deal with short-term disability. And it says basically that we pay second. STD is primary, we're secondary. What that means is, if we coordinate benefits, the one thing that's in the act is an employee cannot get more than 100% of their time. And so that cap has to be made. So if the STD is only paying up to 60%, they continue paying up to 60%. We pay the additional amount. However, we also cap at 900. So they might not have any cap at all. So their 60% might actually be a higher dollar amount than our 900. But we continue paying until we pay up to 900 and up until they hit 100% combined. Be simple. But again, this is another reason why you guys have to administer this program, because you would have to learn 10,000 different short-term disability plans and how they coordinate. What that also means is elimination periods. What if there's a 30-day elimination period? Usually during your 30-day elimination period, they go and they dip into their paid time off bucket, right? What if that maxes out and they still are in the elimination period, they get to 0? We drop down, sort of like an umbrella policy, to cover during that elimination period. If the PTO doesn't last throughout there, and if it's a period where PTO ends elimination period and us, we drop down. We basically don't pay during that pay time off period. But when that period expires and they're still in the elimination period, then we cover 100%. So we're in hooks for primary. Here's the thing: if I were still underwriting short-term disability like I used to with playgrounds, I would simply exclude, and this is what happens in the 13 other states, I would simply exclude any claims that could be covered, whether or not you're in the private plan or the public plan, could be covered under a state paid family medical leave plan. There is nothing in the law that stops a private insurer of putting in an exclusion, because that's a contract between you and they. You have to sign it, they have to sign it. If you don't like it, you can stop doing it short-term disability with them. So what's probably going to happen is either they're going to exclude it outright or change their elimination period to 6 weeks, so that we don't actually cover the same time period. At which time we become short-term disability, they become mid-term disability, and then after 120 or 180 days, long-term disability. So that's what I'm saying. This is going to cause a change in not what is paid, but who pays, and who pays how much of that required. There's a risk that needs to be covered. And it's being sliced and diced in different time periods and in different amounts. And so that's what's going to kind of unfold. And I can't control what short-term disability kids do. So, you want to?
You have one question?
Yes, I just got one question. So is
Just one? Are you crazy? There's a lot going on here.
is the benefit taxable? So
That's a really good question. So here's the thing. We actually have the act says that we have to withhold for every applicable state and federal tax. Doesn't say what's applicable. Division of Revenue in the state of Delaware still hasn't set up. Our regulations are we're going to withhold 3% for state tax. April 15th, we'll actually find out if that was too little or too much. And it'll be, handled as you would any other over or underpayment in your state taxes on April 15th. Federal taxes, as I said, the IRS has given us literally no advice whatsoever, except for there is a thing called Section 45S of the income tax thing that applies to self-funded paid family medical leave benefits right now. It actually went into effect in 2017. Hardly anyone has this or knows about it, but it indicates the federal government is aware of the existence of paid family medical leave programs, although they talk only about private self-insured paid family medical leave programs. So, but at least there's some sort of acknowledgement from the federal government. But I don't even know if the contributions you guys pay to us are tax deductible. If it's a premium, tax deductible. If it's voluntary, ordinary income. So I'm pretty sure it's going to be tax deductible. I just don't know which slot it is. And it's not taxes, so it's not salt. It's contributions. They carefully created this brand new term that doesn't exist. Contribution. It's not a fee. It's a tax. What is it? I don't know. But the one thing for income taxes the federal government says is that if, and this is for the checks that go to your employee, if a source of income is not specifically excluded from income tax payments, you must pay taxes on it. So there's a specific list of exclusions. Paid family medical leave is not mentioned on that list. Therefore, the assumption is it has to be paid just like any other. This is how Al Capone went to jail for illegal, income from prohibition. So that's kind of the thing.
does that mean you're going to get a 1099?
Yeah, we're going to send a 1099 for every claim that we pay out. The other states do. Some of them send a G, some of them send an M, some of them send an MOUSE. We'll figure that out. I think we have something in our regulations. I forget which is because I don't even know what the heck those things are. But yeah, we're sending something out.
Thanks.
I would just say that's a great question because that's a question I would go. I get one other thing. There's some smaller groups that have very great mentality them. They may want to grant. Do they have an option if they make it like we're going to include incarnate or do they just?
So the only parental leave, a lot of people have the old-fashioned maternity leave. But our act says that it has to end our question for grandfathering says it has to be provided, parental leave claims have to be provided regardless of sex, gender, or marital status. So it has to be that way since May of 2020. Any improvement is awesome, but not like one thing I did want to mention is that our computer system is going to have the ability we will pay the claim for everything that our system requires, 80% up to $900 with the duration. And you guys as employers wish to provide additional, more rich benefits, first of all, that's awesome. Second of all, we will calculate the amount for you. So you guys, if you want to do 100% unlimited, we have all your hour and wage information. We'll tell you how much we're paying, and we'll tell you how much you guys should write your own check for basically what we'll call a top-up, sort of like a supplemental life insurance plan. If we're not an employee choice, but an employer choice. And you do all this stuff by employee classes. So if you have your hourly people versus your salaried people, they can have different plans of benefits. All we care about is 80% up to $900. You want to do more for some people, but not others, as long as it isn't like we're doing all the, name your illegal discrimination leave. The better benefit and this other, everyone else gets the lousy benefit. That's not allowed. But besides that legal employment classifications, you guys add additional benefits as you see fit.
A question on the wording, and I think it maybe what you're saying, like the new, the new wording versus the old-fashioned wording, because you look at FMLA and short-term disability, when it talks about maternity, talks about birth of a child, talks about, care after pregnancy. And I see that the wording on this one is caring for a new child. What about the parent or the mother who goes through up to 9-month pregnancy, has a stillbirth, doesn't have child?
Just talking about that. So we follow FMLA. FMLA sucks on this because miscarriage is something we just sweep under the table in this country, and it's horrible. Anyway, if the doctor, so illness and injury related to a pregnancy is either medical leave, if it's the employee who's pregnant, or family caregiver leave, if it's the spouse. Or, if you're unmarried, you don't get anything. So that's or the kid, or the parent. Could be weird, but could happen. Anyway, if that happens, if the doctor, that's the way, so if there's a medical relative and then the birth is done, then it's for healthy children. Parental leave is for healthy children. It's really a bonding with them, not for medical reasons. For stillbirth, if the doctor signs off on a condition of serious health condition certification, then it's treated as any other medical issue. Because also, mental health, substance abuse are all included in this. If the doctor signs off on it. And the doctor's rules and choices are all governed by 4 different types of covered illnesses that are included in FMLA. So
You're saying it would be covered more than the third full point per rep?
either it would be treated like either a medical leave if it's a person itself who had a stillbirth, or family caregiver if it was not. And it would require the doctor to say it was a serious health condition. Other states, and I actually brought this up, so every month we have a copycat between the 14 states that do this, plus the 3 or 4 who are planning to do this very soon. And I brought up stillbirth because one of our developers, the person that I was talking to, had just had a miscarriage. I felt horrible, and I'm like, you have to be qualified. But some states just simply added to their law, boom, it's a covered qualifying event. You just get maybe only 3 weeks, maybe only 2 weeks, maybe a lesser amount because that. Anyway, so that's one of the things. And that would have to be done through a future change in the act. Unfortunately, if you qualify for FMLA, you'll get it. But if you don't qualify for FMLA, you'd be carried down on drugs, which sucks. But also, it sucks we don't cover civil. Yeah.
You guys probably go for 12 weeks when you see if the female employee goes to company A week and so you could take that it's company, you could take at least their employer if you work for that company.
And if they work at the same employer, they're just not allowed to take consecutively unless the employer allows it, and not just on a case-by-case basis for all their employees. So when you sign up as an employer, you're going to be asked a couple of now and forever kind of questions, which I say now and forever, but if you change it, then it's now and forever going forward after that change period. But application year, who has FMLA, and you know that application years, 12 months we talk about, 12 months. But yeah, there's 4 different definitions of 12 months. It's not just calendar year. I would hope that anybody who's doing this just goes to a calendar year definition of application year. It makes life so much easier, especially discussing it with your employees. But there's other options available. You have to do that up front. The other thing is you may or may not give them paid time off, require them to do the paid time off. That has to be done now and forever at the beginning. And as you were just saying, whether or not it's consecutive or because consecutive or concurrent, vice versa, strike that phase up.
The fight for your wife.
First year of law, yep. And that's for birth, adoption, or foster.
Any other? I know I have some questions to ask. To the chat box. Any other questions in the room? Okay. The first one. Are medical people making decisions on the medical leave approvals? Do they work for the state under this program?
Nope. No. We want to stay the heck away from that. We don't want, and most importantly, so it is the patient. Basis upon the employee, sometimes it's the family member. It is the family member's healthcare provider. You may not be a doctor. There's a list, just like an FMLA, of who's included in the healthcare provider. And it's their normal person. And the patient provides the contact information to get us to the person, so it's the correct person. They're the ones making that choice. They just have to meet the requirements of the Act. So one of the biggest problems in other states is getting that certification back from the doctor. In Connecticut, which has really great records about this stuff, 60%, more than 6% of the claims that are denied because the doctor doesn't send back that form. Not because the patient isn't sick enough, because the doctor didn't fill out the form, which means your employees in the morning are putting their parents on the couch, closest to the bathroom, giving them the TV clicker, and saying, "I'm trying to make it home by lunch." And that worker is going to be the worst worker you've ever had. They're not going to be thinking about it. I'm not going to be thinking about it if I was that person. And if you work in an office, big deal, right? They're going to have a couple bad days of productivity. If you work in a manufacturing setting, that's a safety hazard for themselves and for other people. A distracted employee working powerful machinery is dangerous. So that's our big thing. So we're doing this incentive program. Doctors are going to get notified. If they send it back to us, within the first 10 days, they get $20. If they send it to us within 30 days, they get $10. My preference would have been every day after 30, we find you $100 until you give us the form. And as soon as you give us the form, we wipe it out. But we needed to have something to go to bring into court to force them to fill it out. I wasn't allowed to do that. So we're going to find out if, it's always the internal question, which is better, carrot or stick. We're going to find out. Because right now all I got is carrot. But we may eventually move to stick if they still have 60% not answering, which to me is horrifying. That.
Although that did not work,
Yeah, not allowed.
$35 to fill out.
We're paying them so they don't get it. It's illegal to ask the employee. There's a lot of things. So even in states that have this, like California, there's still a lot of barriers, especially for lower wage employees, to actually accessing these things. It's still a promise unfulfilled. In California, 80% of your salary up to $900. Can you live off of that? If you have no savings, that's what you're trying to do. All of a sudden you're less than minimum wage. And so in some states, they have different benefit programs for different wage earners. And one of the things that's a major problem is I see doctors charge $50 to fill out a freaking form. And if you're a low wage earner, that's a barrier to accessing. So in our regulations, we put that in.
Does the 1250 include PTO?
It is 1250. Oh, yeah. So it's service. They actually have to be there up in the seats doing work for 1250 hours. So if they get time off, that is if they have sick and vacation time, it doesn't include any for 1250. That's family medical leave act as well.
Our employees have Unum and they pay 60%, but they also have AFLAC, short-term disability. How will this be calculated?
They have both, like a supplemental plan, like a supplemental short-term. If they all automatically get it, like if every employee gets both, then like they just get two different checks for the same qualifying event, then both would count towards the requirements for whether or not it is a comparable plan. It is voluntary for each employee to make the decision, do I take Aflac or do I not take Aflac? Then we have to go with what every employee gets. And so it's just the unit. And unfortunately, that 75% requirement cuts out a lot of short-term disability. When I underwrote it, almost all of them were 60 or 66%. But just so you know, comparatively speaking, I think I'm going to go with a higher number. But if you just get short-term disability, if you split out these coverages, you only pay for what you use. It's like you only pay for what you use. So if you only use short-term disability with us, you only pay 0.36 or 0.4, one of them, I forget which. But still, when I underwrote, it was 0.55, 0.65 for short-term disability on the same rate basis, per $100 of coverage, per $100 of salary. So we're actually cheaper. It takes long, but it's still a cost savings there. And it should reduce your short-term disability. If your short-term disability costs don't go down, because we're taking a huge chunk of their risk, that's the problem you guys have to take up with your short-term disability.
Our doctors do not provide their personal emails. How many people can have access to the portal from one office?
Yeah, so office-wide, we're actually working on that right now. So there's going to be personas. So that's 5 different personas, which kind of guide what they can see and what they can do inside the online administrative system, what tasks they can perform. And so there's going to be employees, employers, healthcare providers, insurance companies, and CPAs, third-party administrators, as ways to access the online system. CPAs are going to be most complicated because some CPAs just do payroll services, some provide every HR service there is. Some are in between those. So the employee and the employer and the CPA have to inform us. We both have to agree what exact services are being offered by that CPA. You're going to have multiple CPAs, a service provider and an absentee manager. So we'll have different access points, different functionalities for each of those personas. But for employees, you can have multiple people accessing Playbook. Our designers were like, well, then we have to know who in the company is doing which task, so that they can only do those particular tasks. And I said, oh, no way. We're not getting involved in, Jenny was fired, so her task is now being managed by somebody else. You guys figure out, you guys watch over your employees. Your employees are acting as the employer. So they're going to, each employer is going to have several employees that can speak for them. And they're going to be full range of tasks. Because somebody goes on vacation, they might pick up some of the payroll stuff that somebody else normally handles, and vice versa if they go out on paid leave. So we're not getting involved in assigning and reassigning and dropping people. We're going to drop people off, make sure they don't go there incorrectly. But multiple people are going to be allowed to access the employer's account and to perform tasks.
One quick comment on that short-term disability out of that expectation. With short-term disability rates dropping, you would take a second.
Yeah, so we'll pay stuff. So they're going to still they're going to still cover their stuff. Right. So if they don't exclude our stuff, then they're providing the same benefits they do currently, and they shouldn't drop. But if they exclude any qualifying event that could be paid by paid governmental leave program, or they expand their exclusionary period, they better, that's fine. If I were you, they better reduce their rates.
To obtain caregiver leave, does it need to be a minor child?
So, yes, it's minor child unless there are special circumstances and you're there for medical capacity or some other issue. But that's determined by the courts usually. This is like heavy duty stuff about saying that you're going an older person, which is another way that if you have a sibling who's unable to take care of themselves, they become a dependent child if you have guardianship of it. the legal process. We don't get involved. We just get the paperwork and we come on.
To clarify, the business is administering the program, but the state program is the vehicle for payment.
Yeah, we pay. So what you guys are doing are authorizing payments. The idea is that FMLA, you guys have been authorizing people to go off on unpaid leave for 30 years. The decision about whether or not they qualify for the leave shouldn't matter whether it's paid or unpaid. Your decision process is the same. That's why if you have more than 50 employees, except for the paid for it, it's now an insurance plan instead of an unfunded mandate, you guys would probably pick easier than if you've never done that MLA before.
What if employee pays for their short-term disability? Can we still have employees pay 50% of the paid leave premium?
Yeah, so your short-term disability is still a private contract between you and your employees, as long as it meets Department of Insurance regulations, which we have nothing to do with. That relationship and that process for financing will continue. We are just concerned about the paid family medical leave contributions and how that's full.
So many unanswered questions. Will these issues be resolved before the start date?
Nah. Yeah. Send me a list of unanswered questions and we'll try to answer them. If I could be up here for really, and it's already been a long time, but I could do this. I used to teach politics and I had 5-hour courses. So if you guys are willing to go without lunch, slap on our depends and let's do this.
Do company officers have the ability to exclude themselves?
So, a lot of, well, not company officers, but owners. Owners are often not paid through the W-2 process. Many owners are paid through, what is it, a K-2, a K-9, a K something or other. So if, for instance, they don't get a steady salary and a steady paycheck, but rather a percent of profits as a dividend to the number of shares that they hold, that's not reported on a W-2. That's not FICA. If it ain't FICA, it ain't us. But that also means they can't also put in first line.
Any other questions that are those that joined through Zoom?
The one thing about this program is it is extremely fact-driven. You guys all have particular situations where you guys are kind of waking up in the middle of the night. How am I going to do that? Hopefully we thought about them, but I want to hear about them. That's why you guys have my phone number and my email. We want to hear about them before this thing goes live, those unanswered questions. If you have questions about how to handle a particular weird situation, visa holders, all kinds of strange situations, documented workers, one of our largest employers in the state of Mountain Air, has been informed by whoever is informing to them that if somebody goes and somebody says, "Oh, remember that Social Security number I gave you? Yeah, that's not correct. Here it is." They just take the new Social Security number and they move on with their lives. I'm not saying what that means, but I'm just saying we take that Social Security number and we move on with our lives. So there's a lot of interesting one-offs. If you have an interesting one-off, I mean, I want to know about them before we launch this thing, so we have an answer, and we treat everybody in that situation the same way. But that's the key to making this thing work. Everybody gets treated the same if they're in the same situation.
One last question, if you could just run through this one more time. We have employees 10 to 24, not decided if we'll use private or public. Do we need to do anything currently?
Currently, no. And if you don't decide to spend 24, so you're required to provide the parental that you have between 10 and 24. That means right now, if you want to, until December 31st, you can reduce that 12 weeks down to 6 weeks if you want to. However, if you're fine with the 12 weeks, then you could still, starting next September, opt out to a private insurance plan for that parental leave only. Or if you want to opt in and take the other 3 lines of coverage, the medical, family caregiver, and the qualified exit, you can take all 3 of those, or just 1 or 2 of those, or just 1 more of those if you want to, through the public plan, through the opting in, which happens in September. Or if you just want to keep it as is, you don't even have to do anything and if you're paying 100% of the employee of the contribution, you only have to worry about 1/125. You send us a check, it's not a check, it's paperless, it's all going to be bank to bank electronically. But if you send us the money on 4/30, you're golden. So really, it's not until 4/30/25 if you're in that situation. If you didn't want to change, that's the only time you need to do. Yeah.
I work with a property management company, and we have properties in Maryland, New Jersey, and Pennsylvania.
Yeah.
Most of our employees live in those states, which they work.
Mm-hmm.
So we would use FMLA for them. So how does that work for paid FMLA?
So FMLA and paid family, I believe, go on top of each other. They're pre-cooked. So you get, basically, if you're approved for FMLA, then they'll be approved for pay. So if they get 12 weeks under FMLA, maybe they get 6 weeks of a claim check from us. And then if they so choose, an additional up to 6 weeks through unpaid FMLA.
So even though they don't live or work in the state of Delaware?
Well, this FMLA is benefit.
Correct.
The only thing that we require is where do you actually work? So if you live in Maryland and you cross the border for foreign work and you do that 60% of the time, then you have to pay into the pay supplemental leave. If you live in Maryland and you only service Maryland thing, or if you only come over 20% of the time, we don't care. You're out.
Then we don't have to pay them for the paid medical leave either.
Well, you're not paying.
Well, okay. But they wouldn't have to deduct it from their paycheck?
Right. Yeah. The only thing I can handle is intake.
So does that mean as the employer that you're paying the 0.8%, you're only going to pay the 0.8% on that employee?
On the in-state hours and in Delaware hours and the in Delaware wages. And the benefit will only also be paid out 80% of your hours, 80% of your in-state Delaware.
So back to the hybrid. So if they are remote in on their computer from out of state.
Where they physically are located, where they're typing. Not a virtual reality thing. Yeah.
So does that mean that those employees in other states, are they counted towards?
Nope.
They're not. Okay. Well,